Today, we will be discussing a type of vasculitis which is not only very interesting but also most common type of vasculitis in adults. Yes, it is giant cell arteritis, also known as temporal arteritis. The word arteritis means inflammation of arteries. Its name giant cell arteritis is given because of its pathological feature in which giant cells along with other inflammatory cells are seen. And the other name is temporal arteritis. It makes it easy for us to recall its main clinical feature, that is involvement of superficial temporal artery. So we will be discussing its general features, pathogenesis, clinical presentation, investigations, treatment options, and in the end, we will be discussing a case scenario that will help your brain to retain this clinical condition for a longer period of time. Giant cell arteritis or GCA is basically inflammation of medium to large sized vessels. The commonly involved arteries are temporal arteries, which is a convenient biopsy site, common external and internal carotid arteries, orbital arteries, especially posterior ciliary and ophthalmic arteries, axillary arteries, coronary arteries, aorta, and less commonly mesenteric, renal, and femoral arteries. It leads to ischemia or even infarction of the area of supply. Let's understand the pathogenesis of giant cell arteritis. Giant cell arteritis is basically caused by cell-mediated immunity. The initial trigger is still unknown. One hypothesis says that it could be actinic damage, means chronic sun exposure could be the source of injury. Others says that elastin, which is part of the internal elastic lamina, could be inciting factor. But still, the exact antigen has not yet been spotted. Firstly, as a result of this antigen, there is activation of dendritic cells which are present in adventitia. These dendritic cells are basically antigen presenting cells, so they start producing chemokines that recruit CD4 plus helper T cells. So active CD4 plus helper T cells polarize and convert into Th1 cells which produce interferon gamma and Th17 cells which produce interleukin 17. These cytokines invite more and more monocytes at this place, and they then differentiate into macrophages. At this stage, these monocytes fuse to form characteristic giant cells. Yes, these are those giant cells which are hallmark of this condition. They are so important that this disease has been named after them. Now, these inflammatory cells produce various interleukins like interleukin 1, interleukin 6, and interferon gamma. All of them are powerful pro-inflammatory cytokines. They stimulate the production of acute phase proteins, also called as acute phase reactants. As the level of these acute phase reactants start to build up in the blood, patient starts getting generalized symptoms of inflammation. These are fever, malaise, generalized weakness, etc. At this point, if you get blood tests done, there will be high ESR and C-reactive protein. These inflammatory cells produce proteolytic enzymes such as MMPs or matrix metalloproteinases, nitric oxide, and growth factors, which are vascular endothelial growth factor and platelet-derived growth factor. They then together cause local vascular damage. By damage, I mean that there is destruction of elastic lamina, concentric intimal hyperplasia and proliferation, which is done as a repair mechanism, and abnormal intimal thickening. So, as a result of this process, arterial wall narrowing starts to a level that there is complete occlusion. So, when the blood supply is cut off, it leads to ischemia of the area. This is called end organ damage or target organ damage. For example, if it's coronary artery, it can present as heart attack. If it's one of the cerebral arteries, it can lead to stroke and so on. Giant cell arteritis has a close association with another condition called polymyalgia rheumatica or PMR. PMR is not a vasculitis, but it is characterized by pain in proximal muscles like pelvic and shoulder muscles. Remember that there is only pain but no weakness in this condition. Almost 50% of the patients with giant cell arteritis have underlying PMR. These both conditions typically present in older age groups and have a female preponderance.